Which is the largest branch of axillary artery?
In this image you're seeing is axillary artery. Its commencement, its termination, its course, its relations, its branches. All I am going to describe in this image. Firstly, why this is called axillary artery? The reason is it's continuing its course in the axilla. Regarding commencement, the start point of this artery is from the outer border of the first rib, where subclavian artery continues as axillary artery. So you're seeing this line here. This is indicating that it is the start, the commencement of this axillary artery, right? So subclavian artery terminates at the outer border of the first rib and continues as axillary artery. Now, after traversing the entire portion of the axilla, it descends down and enters into the arm by crossing the lower border of teres major. Here is seeing is this line that indicates it's the lower border of this muscle teres major. So that's the point of termination of axillary artery where it continues as brachial artery in the arm. So it's not a branch of subclavian, rather it's a continuation of subclavian artery. Similarly, brachial artery is not a branch of axillary artery but a continuation of axillary artery. Now for the convenience of this study, we've divided this artery into three parts according to its relations with pectoralis minor. This muscle pectoralis minor, you can see it is crossing anterior in front of the axillary artery and reaching up to insert onto the coracoid process of the scapula. So the course of this artery, the green color I'm using, that runs behind the pectoralis minor, this portion of the artery is the second part. Now from outer border of the first rib up till the upper border of pectoralis minor, this much portion, the yellow color I'm using, is the first part. Now from lower border of pectoralis minor up till the lower border of teres major, the purple color I'm using, this indicates this is the third part of axillary artery. Remember, this course of this artery is accompanied by the cords of the brachial plexus, and all of it is enclosed in the continuation of prevertebral fascia that's called axillary sheath. Remember the three cords of brachial plexus, they are named according to their relations with the axillary artery at its second part. So lateral cord will be here, posterior cord will be running behind to this artery, and the medial cord will be running in medial relation to this artery at its second part. Posterior cord, lateral cord, and you have his medial cord. These are the three cords of brachial plexus in relation with the second part of axillary artery. Remember that this artery runs behind pectoralis minor, but it runs anterior to teres major. Anterior relation and teres major lies in posterior relation. So this was about the commencement, termination, course and relations of the axillary artery in the axilla. Now talking about the branches given out from this axillary artery. So it's easy for you to remember because as there are parts of this axillary artery, similar is the number of branches arising. So from the first part, it's only one branch that arises, and that branch is superior thoracic artery, also called as supreme thoracic artery. Remember that this artery elongates to supply blood to the breast in females. From the second part, there are two branches arising. One you can see is thoracoacromial artery, which actually is a trunk. This is a trunk. So we prefer calling it as thoracoacromial trunk. As you can see, that's a trunk because it gives out four branches, right? And out of those four branches, remember there are two bony branches and two muscular branches, right? So the two bony branches will be one for this clavicle. You can see this is A, B, C, and D. So thoracoacromial artery gives four branches. A I have drawn is clavicular branch. The second one is for the acromian. So these are the two bony branches. And then you have a branch reaching to the pectoral muscles, pectoral branch. And then other branch is reaching to supply blood to the deltoid. So remember, these are the four branches of thoracoacromial trunk. Now, important point about this clavicular artery is don't confuse it to be the nutrient artery for the clavicle, because it is not the nutritional artery to the clavicle. It provides periosteal blood supply to the clavicle through the periosteal branches from the clavicular branch of thoracoacromial artery. But it is a must that you should know that what is the nutritional artery to the clavicle. It's a branch from the suprascapular artery. And the artery will be directed medially or laterally. So remember that the growing end of the clavicle is the medial or the sternal end, right? It is a bulkier and quadrangular end, and it is facing towards the head, right? So the lateral end of the clavicle is not the growing end, and the nutritional artery, the nutritional foramen, will be directed laterally in the clavicle.
Now talking about the acromial branch of thoracoacromial artery.
Here you are seeing is the thoracoacromial artery. And these are the four branches arising, out of which this one is the acromial branch of the thoracoacromial artery. So this is how here you can see that it participates in anastomosis around the acromion, that it's the summit of the shoulder where it anastomoses with the other two branches. One you can see is a branch from the suprascapular artery that also reaches to this point, and even a branch, an ascending branch from the posterior circumflex humeral artery. Although some books have even included an ascending branch from the anterior circumflex humeral artery also reaching to this point. So that's how this point you just need to remember that the acromial branch will obviously participate in an anastomosis around the acromion. Now one more image to show you the relation of acromial branch of thoracoacromial artery. There is this sensory branch of lateral pectoral nerve. This you are seeing is the lateral pectoral nerve, and it gives a sensory branch which reaches to the acromioclavicular joint along with this acromial branch of thoracoacromial artery. Now this nerve carries proprioceptive sensations from this joint. So that's a relation of acromial branch of thoracoacromial artery. Then regarding pectoral branches, remember pectoral branches of course will perforate this muscle, pectoralis minor, pectoralis major, and will also elongate in case of females to supply the breast. It's here you are seeing the pectoral branch of thoracoacromial artery, which is entering into the pectoral region after piercing this muscle pectoralis minor, and then the pectoralis major, and then reaching down to supply the breast. This is the artery, how it is contributing to the blood supply of the breast. Now regarding deltoid branch, this also is very important. The deltoid branch of the thoracoacromial artery will run in the deltopectoral groove. I hope you know that deltopectoral groove. It's a surface landmark. It's like the people who have built up body contours. You can easily find that there is a groove between the deltoid and the pectoralis major. Over to that groove, there are structures running. One of the important structure that passes in the deltopectoral groove is cephalic vein. And along with that, it's this, the deltoid branch of thoracoacromial artery, which runs with the cephalic vein in the deltopectoral groove. And don't forget the third thing there. and that is the lymphatics from the thumb and its web. The lymphatics from the thumb and its web, they accompany the cephalic vein and they run along the lateral border of the forearm and then along the lateral border of the biceps brachii,
and then it enters into the deltopectoral groove.
along with the cephalic vein, and then they pierce the clavipectoral fascia along with the cephalic vein and ultimately drains into the infraclavicular group of lymph nodes, which is also called cephalic nodes. So deltopectoral node is present in the deltopectoral groove before these lymphatics pierce the clavipectoral fascia. So remember its course, the lymphatics, they accompany the entire course along with this vein, the cephalic vein. While in the same deltopectoral groove, there was this artery coming out. This artery is a branch from the thoracoacromial artery, and this is the deltoid branch of thoracoacromial artery. So remember the three contents present in the deltopectoral groove. These are cephalic vein, the lymphatics from the thumb and its web, the lateral border of the forearm, and the deltoid branch of thoracoacromial artery. These are the three structures present in the deltopectoral groove. In the same image, let me cover the lymphatic drainage of the upper limb. It's easy. You can see that the entire lymphatic drainage, if it's asked in a single line, that the entire lymphatic drainage of the upper limb drains into the lateral group of axillary lymph nodes. But in your MCQ, sometimes they place this option as supratrochlear or epitrochlean lymph nodes. So remember that this is an intermediate group of lymph nodes present over to this cubitus region in front of the trochlea, and these are an intermediate lymph nodes for the lymphatics from the ulnar side or the ulnar border of the forearm. But ultimately, these lymphatics also drain into the lateral group of axillary lymph nodes, while the thumb and its web and the lateral border of the forearm that drains into the infraclavicular group of lymph nodes, also called as cephalic lymph nodes. They may also drain via the deltopectoral nodes. So all these three structures, remember the cephalic vein, the lymphatics from the thumb, and
The deltoid branch of thoracoacromial artery.
all this have to be actually come outside and go inside the axilla, but there is a membrane in between, and that is called clavipectoral fascia. So remember one important point about the thoracoacromial artery, that this artery pierces clavipectoral fascia. Other structures which pierce clavipectoral fascia is cephalic vein, then lateral pectoral nerve, and deeper lymphatics from breast and lymphatics from thumb. So there are five structures: an artery, a vein, a nerve, and two lymphatics. They are the five structures which pierce clavipectoral fascia. Let me write everything here. Clavicular artery is not a nutritional artery. Nutritional artery to clavicle is a branch from suprascapular artery. Suprascapular, is a branch of thyrocervical trunk from the first part of subclavian artery. Now, talking about the second branch arising from the second part of axillary artery, and that is lateral thoracic artery. Important point about this is that this artery, of course, is arising from the second part, and it will be running along the lateral border of pectoralis minor, as you can see in the image, under the cover of pectoralis major. Another important point with this lateral thoracic artery you can remember is that along to this artery you find is the anterior group of axillary lymph nodes. Anterior group of axillary lymph nodes, also called as pectoral group of lymph nodes. And at the same side you will find is the vein, the lateral thoracic vein. Remember that the lateral thoracic vein has a great significance. If you remember the cross communication or the bypass circulation in case of SVC or IVC obstruction. This lateral thoracic vein dilates and communicates to an intercommunicating vein from the superficial inferior epigastric vein, right, that drains into the femoral vein. Superficial inferior epigastric vein, so from to the lateral thoracic vein, there is a communicating vein, and that is called Thoraco-epigastric vein. So that channel dilates up for a parallel bypass circulation in case of SVC or IVC obstruction. So don't forget about the important points about this vein. This is lateral thoracic vein. Now talking about the third part of axillary artery. So from there, three branches going to arise: anterior circumflex humeral artery and posterior circumflex humeral arteries. As you can see, they're going to surround the surgical neck of humerus anteriorly and posteriorly, and will anastomose with each other on the lateral side of the surgical neck. Out of these two, remember that posterior circumflex humeral is a larger branch. This is a smaller branch. Anterior circumflex is a smaller branch. Posterior circumflex humeral artery is a longer branch out of these two. And this posterior circumflex humeral artery, remember, it runs along with its nerve, accompanying nerve, and that nerve is axillary nerve. Both of these structures are under the cover of deltoid. The posterior and lateral fibers of deltoid cover this posterior circumflex humeral artery and axillary nerve. And this anterior circumflex humeral artery, remember, it gives an ascending branch. It gives an ascending branch anteriorly between the lesser and greater tubercles through the intertubercular sulcus. We also call it as bicipital groove, through which the tendon of long head of biceps along with its synovial sheath emerges out, and it's this ascending branch from the anterior circumflex humeral artery which reaches to supply the shoulder joint. This is the ascending branch. Now talking about the third and the last and the largest branch of axillary artery, and that is subscapular artery. Largest because it has a wide caliber. Although I'll tell you, lengthwise it's not so long because it gets a different name in its course. So while running along the lateral border of the scapula, this subscapular artery gives its branch, and this branch you can see is called circumflex scapular artery. So this branch from subscapular artery is given out medially on the dorsum of the scapula. It reaches there by perforating that muscle teres minor and participates in the anastomosis on the back of scapula. Now, after giving out the circumflex scapular artery, subscapular artery gets a different name, and this continuation of subscapular artery down below is called thoracodorsal artery. It will be easy for you to remember because you must have read about a nerve with a similar name. Yes, that is thoracodorsal nerve. This nerve is thoracodorsal nerve. So now both thoracodorsal nerve and thoracodorsal artery, they will run along the lateral border of latissimus dorsi. This nerve innervates latissimus dorsi on its deeper surface. Similarly will be the course of thoracodorsal artery. It will run along the lateral border of latissimus dorsi and will reach beneath to that muscle to supply blood to latissimus dorsi. But remember, in its course, it also gives branches to the underlying muscle on the lateral side of the chest wall, and that is serratus anterior. So thoracodorsal artery provides blood to serratus anterior, but mainly the major portion of this artery provides blood to latissimus dorsi. One more thing I've reminded about is along this artery, subscapular artery, of course, there will be a parallel vein, and this parallel vein will be subscapular scapular vein. This I'm telling you because along its course you will find group of lymph nodes, and these group of lymph nodes are called posterior group of axillary lymph nodes. So remember that the anterior group of axillary lymph nodes lie along the lateral thoracic vessels along the lateral border of pectoralis minor. However, the posterior group of axillary lymph nodes, they lie along the course of subscapular vessels along the lateral border of the scapula. Now, before finishing off, let me cover some important points left out. One is like in case of intermuscular spaces, if they ask, structures passing through the intermuscular spaces in the scapular region. When you slightly abduct the arm, you find is a quadrangular space, then an upper and a lower triangular space. So remember that the circumflex scapular artery, it passes through the upper triangular space, and this posterior circumflex humeral vessels along with the axillary nerve will pass through the quadrangular space. Remember the lower triangular space, it is this profunda brachial artery along with the radial nerve and its vena comitatus. Those are the structures passing through the lower triangular intermuscular space in the scapular region. Just a few more important points I'm reminded of. Why not cover the entire group of axillary lymph nodes, because the relations are commonly asked. So you should know, I have taught you about the anterior and posterior axillary lymph nodes. Remember, there's a lateral group of axillary lymph nodes as well, and that lateral will be actually lying along the continuation of the axillary artery in medial relation to the neck of humerus, right? So that will be the lowest portion of this axillary artery here somewhere, like after giving out subscapular artery here, this one. These are the lateral group of axillary lymph nodes. Where will you find the central group? Now, central group will be also in relation to the third part of axillary artery, but before giving out its three branches. So it's here you will find is the central group of axillary lymph nodes. Now what is left is the apical group. Remember, there are five groups of axillary lymph nodes: anterior, posterior, lateral, then central, and above to that is the apical group. Now, apical group of lymph nodes will be in relation to the first part of axillary artery, somewhere at its commencement here. These are called the apical group of axillary lymph nodes. Remember, the deeper lymphatics from the breast, they drain into the apical group of axillary lymph nodes after perforating the clavipectoral fascia, while the superficial lymphatics of the breast, including the subareolar sappi that pass through the axillary tail of Spence, and they will perforate the pectoral fascia. That foramen is called foramen of Langer, and through that those lymphatics will drain into the anterior or the pectoral group of axillary lymph nodes. The major lymphatics from the breast, remember, is going into the anterior group of axillary lymph nodes. What else can I add here? Because this image is going to, this slide actually is going to give you enough information. It will help you summarize all little facts regarding this axillary artery. Because from the anterior circumflex humeral artery, I have drawn this ascending branch, and don't forget that there will be a descending branch from the posterior circumflex. Like it will go reverse, like anterior will give an ascending branch, right? Will ascend into intertubercular sulcus to supply the shoulder joint. Similarly, in a posterior circumflex humeral artery will give a descending branch. This is called descending branch of posterior circumflex humeral artery. Now this will descend down and will anastomose with an ascending branch from below. Remember, on the back of humerus there's a radial groove, in that is profunda brachial artery, and that profunda brachial artery will give an ascending branch which will anastomose with this descending branch of the posterior circumflex humeral artery on the back of humerus in the upper half. Now this image is to show you the posterior relations of axillary artery and its branches. So this is the posterior view of the shoulder region. What all you can appreciate here, of course, suprascapular artery has been shown that how it is winding, passing through the suprascapular notch, then glenohumeral notch, and from supraspinous fossa it descends down into the infraspinous fossa to supply blood to both supraspinatus and infraspinatus. Remember, it is this artery, suprascapular artery, which provides a nutritional branch to clavicle.
and scapula also.
It also gives branches to the acromian. Can you appreciate this circumflex scapular artery? I taught you that this is a branch from this artery, subscapular artery. They have shown is in dotted lines because that's something not in the direct view. It's lying in anterior relation to the scapula, right? So subscapular artery, one thing I said, it's the largest branch. Let me write it again. Subscapular artery is the largest branch of axillary artery, but it's not a very long artery because it soon gives its circumflex scapular artery. This I taught you, it will be perforating this muscle. This perforates this muscle here on the lateral border of the scapula on the dorsal side in its upper portion. This muscle is teres minor. So after perforating teres minor, it reaches onto the dorsum of the scapula, right? In the infraspinous fossa, here it will participate in the anastomosis. You can see that subscapular artery is also reaching there, circumflex scapular, and from the medial side, there is this artery running down. This artery will also participate in this anastomosis on the dorsum of the scapula. Now, this artery is dorsal scapular artery. This dorsal scapular artery is not always present. The important point.
It's a branch of subclavian artery. It arises
Behind that muscle, scalenus anterior, because that's the muscle which divides subscapular artery into three parts. So dorsal scapular artery is an occasional branch from the second part of subclavian artery, but because it's not always present, so in case if it's not there, right, it will be replaced by another artery, and that is called deep branch of transverse cervical artery. This transverse cervical artery is also a branch of thyrocervical trunk given out from the first part of subclavian. So there's an option between these two arteries which will run along the medial border of the scapula. And don't forget that this artery will be accompanied by a nerve of similar name, and that is dorsal scapular nerve. This nerve and vessels, they will be running deeper to the three muscles it innervates, right? Levator, rhomboides minor, rhomboides major. That means they will be running below to the second layer of muscles of the back. Above to these muscles, there is this spinal accessory nerve that descends down, which will supply trapezius. So dorsal scapular nerve and vessels will innervate the muscles on its deeper surface. And now can you see this thoracoacromial artery I taught you? It is the continuation of subscapular artery along the lateral border of the scapula and reaches down below this muscle latissimus dorsi to supply this. And in its course, it also supplies blood to serratus anterior. Another thing you're seeing is this brachial artery, right? So axillary artery continues as brachial artery after crossing this lower border of teres major muscle. And you can also appreciate that this axillary artery is lying in anterior relation to teres major. And it was in posterior relation to which muscle? Yes, pectoralis minor. Now, because anatomy cannot be taught completely, we only teach what is important. So, one thing, because it's seen here in this image, I'm going to tell you that remember that both the anterior and posterior circumflex humeral arteries, they both of them will give ascending and descending and transverse branches. Remember the medial and lateral circumflex femoral arteries? Similarly here also. There also they were giving ascending, descending and transverse branches. Medial and lateral circumflex femoral arteries. Similarly here also. Both these arteries will give ascending, descending and transverse branches. The transverse branches of the two will reach on the lateral side of the surgical neck of humerus to anastomose with each other. And ascending of anterior is more prominent. That's why we mentioned that it is running in the intertubercular sulcus. You can see here that this artery is reaching into the intertubercular sulcus. This artery is from the anterior circumflex humeral artery, ascending branch. Similarly, it will also give a descending branch which will supply blood in the upper portion of the humerus, the periosteal, and the adjoining muscles. Similarly, in a posterior circumflex humeral artery has a prominent descending branch. This I taught you is the descending branch from the posterior circumflex humeral artery. This will anastomose with an ascending branch from the profunda brachial artery in the upper portion of the back of arm. It also gives ascending branches. Posterior circumflex also gives minor ascending branches. They will supply the shoulder joint. So both these arteries give ascending, descending and transverse branches, but in anterior circumflex it's the ascending which is a prominent branch, and in posterior circumflex humeral it's descending, that's a prominent branch. This is another image showing the relations of axillary artery. So this is the first part of the axillary artery, this is second part, and this is the third part. Now look here, that why we keep on emphasizing that the nomenclature of the cords of brachial plexus is named according to its relations to the second part of the axillary artery. Because in the first part you can see that the posterior cord is not actually posterior and medial cord is not actually medially to the axillary artery, right? But they come in the proper alignment as to their names. They are related. So now in the second part you can see that the lateral cord is in lateral relation, the posterior cord comes to lie in the posterior relation, and similarly the medial cord comes to lie in the medial relation only in the second part. Again in the third part you will find that these cords actually diverge out because of their various branches, right? So that's why it's the second part of axillary artery according to which there is the nomenclature of the three different cords of brachial plexus. One more thing I would like to add up here, that all these structures you are seeing is into a sheath. This is enclosed into a sheath, and the sheath is called axillary sheath. This axillary sheath is a continuation of, or a modification you can say, is a modification of prevertebral fascia of neck. Now this image I have included to explain you the course of thoracodorsal artery. So as you know that axillary artery in its third part gives out its largest branch, the subscapular artery. So this was the largest branch of axillary artery. Now after giving out its branch, the circumflex scapular artery, which is even longer than the length of the subscapular artery, it perforates teres minor muscle, this muscle teres minor. It perforates this and reaches in the dorsum of scapula to participate in the anastomosis in the dorsum of scapula. The dorsal scapular artery, the course you can see, it's running down here under to this muscle. This muscle you know is latissimus dorsi. And this muscle you can see how its fibers are arising from the upper 8 ribs. This muscle is serratus anterior. It arises from the outer surface of the upper 8 ribs behind to the anterior angle, but at the same sides on outer surface of the lower 8 ribs. This you're seeing anterior to the anterior angle. This muscle that takes origin is external oblique abdominis. So it arises from the upper 8 ribs, serratus anterior. External oblique arises from the lower 8 ribs. Now focus on this course. So this artery, the subscapular artery, after giving out circumflex scapular artery, continues as thoracodorsal artery. It runs under the cover of latissimus dorsi, giving out its transverse branches which are intramuscular. Remember, it is not inter, it is intramuscular. And it also gives anteriorly few branches to this muscle, serratus anterior, right? And it continues as vertical branches which are also intramuscular. So in its course, it gives out transverse branches, vertical branches to supply this muscle, latissimus dorsi, and it gives anterior branches to supply serratus anterior muscle as well. Remember, it is not very exactly in the mid-axillary line. Don't confuse. In case if sometimes they might ask like which structure runs in the mid-axillary line. So don't say that it is thoracodorsal artery. So what will you answer if it's asked like which structure runs in the mid-axillary line? You know, the nerve and vessels I'm talking. The answer will be long thoracic nerve of Bell. This long thoracic nerve of Bell, which is also called as nerve to serratus anterior. It arises from the roots of C5, C6 and C7. This nerve runs in the mid-axillary line. Okay, now that was all I could gather up and collect the various important points to cover up in a single video.